Hey there, it's Therapy and Relaxation. Today, we're talking about treatment-resistant depression with anxiety. Let's go! Treatment-resistant depression, especially when accompanied by anxiety, is a challenging and often misunderstood condition. For millions of people around the world, traditional antidepressant medications and talk therapy provide relief, helping them reclaim their lives from the grip of depression. But for others, these first-line treatments don't bring the hoped-for improvement. When depression lingers despite multiple attempts at treatment, and when anxiety is an ever-present companion, the journey can feel isolating and overwhelming. Imagine waking up each day with a sense of heaviness, a weight that makes even the simplest tasks seem insurmountable. Alongside the sadness and lack of motivation, anxiety weaves itself through daily life, racing thoughts, a pounding heart, and a persistent sense of dread. This combination can create a cycle that is difficult to break. The anxiety amplifies the depression, and the depression deepens the anxiety, making it hard to find a way out. Treatment-resistant depression is typically defined as depression that does not improve after trying at least 2 different antidepressant medications at adequate doses and durations. It's important to remember that treatment-resistant does not mean untreatable. Instead, it signals the need for a different approach, one that looks beyond the standard treatments and considers the unique needs of each individual. For those living with both depression and anxiety, the challenge is even greater. Anxiety can make it harder to stick with treatment plans, attend appointments, or even reach out for help. It can also increase sensitivity to medication side effects, making it more difficult to find an effective and tolerable regimen. But hope remains, rooted in the growing understanding of the complex interplay between depression and anxiety, and in the expanding array of treatment options. One important step is a thorough assessment by a mental health professional. Sometimes what appears to be treatment-resistant depression is complicated by other factors, such as undiagnosed bipolar disorder, co-occurring substance use, or medical conditions like thyroid problems. A comprehensive evaluation can help clarify the diagnosis and guide the next steps. When it comes to treatment, a combination of approaches is often most effective. This might include trying different classes of medications, such as adding an antipsychotic or a mood stabilizer to an antidepressant, or considering the newer treatments like ketamine infusions or esketamine nasal spray. For some, transcranial magnetic stimulation, TMS, or electroconvulsive therapy, ECT, can provide significant relief when other treatments have failed. Psychotherapy remains a cornerstone of care, especially therapies tailored to both depression and anxiety. Cognitive behavioral therapy, CBT, acceptance and commitment therapy, ACT, and mindfulness-based approaches can help people develop new ways of thinking, coping, and relating to their emotions. Group therapy and support groups can also offer a sense of connection and understanding, helping to counteract the isolation that often accompanies these conditions. Lifestyle changes, while not a cure, can play a supportive role. Regular physical activity, even gentle walks, can boost mood and reduce anxiety. A balanced diet, good sleep hygiene, and mindfulness practices like meditation or yoga can help create a foundation for healing. It's also important to nurture social connections, even when depression and anxiety make it difficult to reach out. Living with treatment-resistant depression and anxiety can be a long and difficult road, but it's important to remember that progress is possible. Each step, no matter how small, is a testament to resilience and hope. With the right support, a willingness to explore different options, and patience with the process, many people find a path toward relief and a renewed sense of possibility. Thanks for sticking around. Don't forget to check out therapyandrelaxation.com for more. See you tomorrow.